Infants require sufficient hydration and nutrition to thrive and develop. Most infants are able to successfully feed innately at birth. But at-risk infants, such as those born prematurely or with complex medical conditions, are more prone to feeding and swallowing difficulties. In fact, over 100,000 infants in the US alone are diagnosed with a feeding or swallowing difficulty each year. Now, for those of us that eat or drink normally, understanding what that means is kind of difficult. But for these at-risk infants, the simple act of breast or bottle feeding can result in the liquid going the wrong way or entering their lungs when they eat. This is not only uncomfortable, as any of us that have coughed or choked during swallowing know, but if it happens over and over again, it can actually result in the infants developing pneumonia, progressive lung disease and permanent lung damage, the inability for the infant to maintain or grow their weight, and in some cases it can even result in death. So what can we do about this? Well, I think right now in 2021, we're all aware of the incredible life-saving measures, things like ventilation and oxygen support, and feeding tubes. But what if there was a way that we could help these sick infants without surgery and without special equipment? What if there was a way that these infants could feed safely? My research looks at just one such technique. We specifically were looking at if changing the position of the infant during feeding could prevent that milk from going the wrong way while they swallow. So I set out to answer one main question. Does placing an infant on their side while they eat, like in picture A, prevent the milk from going the wrong way as compared to when they're fed in a cradled or upright position, like in picture B? So to do this, we actually took X-ray videos of 8 sick or at-risk infants swallowing. We compared their swallows directly between when they were fed in a cradled upright position and when they were fed on their sides. And what we found was, by looking at these X-ray videos where we could see inside their necks when they swallowed, we found that simply feeding them on their side reduced, or in some cases completely prevented, the occurrence of milk going the wrong way. In medicine, we talk a lot about the simplest, least invasive treatment method. Well, we found that simply placing infants on their sides when they swallow can help them feed safely without putting their lungs or their lives at risk.